AM 1300 WMEL.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Good afternoon, everyone. Welcome to Helping Seniors, the radio arm of Helping Seniors of Brevard. My name is Kay Kaiser. I'm sitting in for Joe Steckler today. He had to take his grandchildren to the airport, so we hope that all that are tuning in, that we're going to have a wonderful time today with our two panelists. But before I introduce them, I'd like to shout out a personal thank you to our sponsors. And we'll start out with Gentiva Home Health, the Eye Institute, Solid Bite Dental Implants, William Johnson, an elder law attorney, WMEL AM 1300, thank you, Wuesthoff Hospital Systems, which we are our guest today, Wuesthoff Home Care, RenCare Medical Alert, and that's the monitoring system. You wear the pendant and so forth, but he's got many more options there as well. Atlantic Shores Rehabilitation and Nursing, and The Social. And for those who are not familiar with The Social, it's an adult daycare that recently opened in the Palm Bay area. So I want to take just a moment here and put a special thank you to the man who is behind Helping Seniors of Brevard, Mr. Joe Steckler. And I have to put a personal thank you to his wife, knowing all the things he does and the patience she must have as well. But Joe Steckler, our president, our founder of Helping Seniors of Brevard, has been doing radio, I think, for, 20 years, I believe, at this point, going back to even when WMEL was 920, but nonetheless, he is an amazing, amazing man who has the compassion and the, there's just too many adverbs and adjectives to describe Joe Steckler, but he had a vision after leaving with the Brevard Alzheimer's to really reach out and help all seniors in Brevard County. And we certainly are doing that because we're approaching 500 calls that have come in, and we're not even a year old. We opened our doors last August 11th and shared office space with the Space Coast Center of Independent Living over in Rockledge. And it's just been a wonderful, wonderful ride here to know that we're reaching out and helping those callers that are looking for senior resources. And it's just amazing. So without further ado, I'd like to introduce our two panelists today from Wuesthoff Home Health. We have Kelley Way. Welcome, Kelley.
Thank you.
Now
glad to be here.
Yeah, well, great. We are glad to have you too. I'm stumbling here on my words today. That's unusual. I understand you're an RN.
Yes.
And a clinical supervisor at Wuesthoff. Is that correct?
It is.
Okay. We also have in our studio Cathy Pague. Welcome, Cathy.
Thank you, Kay.
And your position at Wuesthoff is the home care coordinator. Is that correct?
Yes.
Okay.
It is.
Mm-hmm. Wonderful. Well, I understand from some of my notes here that Wuesthoff Home Health has been serving Brevard County residents for 30 years. Is that right?
Yes.
Celebrating in October.
Woo. You've got a big celebration coming up planned for
in
that?
October,
Yes, we have an open house at our location on Spyglass Hill Road coming in October.
Okay.
And more information will be given. You could call our office at 321-253-2200 to receive more information, to be invited to come out and celebrate our open house that we've been caring for Brevard County residents for 30 years.
Excellent, excellent. So do you have anything, and this is totally open to the public, is that correct?
Yes.
Okay.
It's going to be a really fun event.
It is.
I bet.
And a big thank you to the patients.
Oh, yes, absolutely. Well, you've been an icon in Brevard County, that's for sure. And I'm sure that you're doing a lot of great things here. I understand that, Kelley, you being a clinical supervisor and an RN, why don't you explain to our listening audience some of the duties that you do in an average day?
Wow, that's a lot. You want me to sum that up? We actually have a lot of fun in the office. It's definitely challenging on some days, and others it's a breeze, but I have one of the most amazing teams. So from the beginning of our intake department, when the referrals come in, we have a hospital liaison, Karen, where we get the hospital referrals from, and we service all of Brevard County.
Okay.
So from the beginning of the day when the referrals come in through intake, from the process all the way to the end of getting the schedules done for the next day, we just have an awesome team. It's
That makes a big difference, doesn't it?
Yeah. It like I said, can be a very challenging day, but having all the employees that we have and the resources that we have, they just go that extra mile. There isn't anything in their eyes that we can't do.
Okay, that's wonderful. By the way, I want to invite anyone listening on the show today, if you would like to have a comment or a question to any of our panelists, by all means, I would like you to call 631-1300. They, I'm sure, would welcome any of your questions or comments that you have about Wuesthoff Home Health. In addition, I want to remind you, although I'm not at the office right now as the information specialist for Helping Seniors of Brevard, I'm sure I'll have some people on our recording when I get back to the office. Our number is 473-7770. So if anyone out there, you're looking for resources, because we understand it's extremely difficult to navigate the elder system. And it's our pleasure to be able to put you in touch. And, on a personal note, I become more of a case manager because I ask my callers to really call me back. Let me know how those resources work for you. And the majority of them do. And if they don't, I will call them. So we want to make sure that we're doing our job. Now, it's certainly we can't help 100%, but we do our best. We keep digging. And I think there's not a day that goes by that I don't have another resource added to my book. So nonetheless, I want to come back to Kelley Way here from Wuesthoff Home. How long have you been with Wuesthoff?
Oh, in total, I've been with Wuesthoff since 1989, but not in this position. In this position, just under 2 years.
Okay. All right. And how about you, Cathy Pague, with Wuesthoff?
I'm approaching my 1 year anniversary.
Well, there you go.
Yes. So
tell the listening audience some of the things that you do on a typical day.
The listening audience probably meets me at health fairs.
Mm-hmm.
I attend all the health fairs on behalf of Wuesthoff Home Health, answer their questions, and I also go to the physicians' offices and try to coordinate care with the physicians, because you don't need to have been in the hospital to receive home health.
Okay.
Mm-hmm.
All right. Well, that makes sense. Now, we talked briefly, Kelley Way, about hospital liaison and a case manager.
Mm-hmm.
Can you tell us a little bit more about that aspect?
Yes. The hospital liaison, and actually they work very well. She works very well with Cathy. We get referrals from the physician's office, but the majority of our referrals do come from the hospital. And in that happening, she coordinates very well with the case managers there in each one of our facilities. And we are able to find out and coordinate with DME and all the other resources that the patient may need prior to them discharging from the hospital. So we can get the supplies and everything coordinated before the patient goes home, which is very instrumental in how well they will do. So I have to say that we do really well with that, because if you go home and you don't have what you need, you're not going to be able to do an effective job. And Karen certainly
Absolutely.
does very well with coordinating with the case managers and the physicians to get the patient exactly what they need before they go home. In saying that, there are some times where we will meet some challenges. We just had an interesting case that we needed to get some trach care done, and like I said, there isn't anything we can't do. We found out in this case that if we get in contact with the right DME who can get in contact with the correct therapist, we now have that therapist coming to do, that respiratory therapist coming to do some education for us.
Good.
She's setting up a program, and we'll be able to work very close with those types of patients. So that's not the only type of patient that we service. I'm just trying to show how important it is that when we don't have something started, we can certainly connect with the right people to get specialty patients covered.
Okay, very good. Well, Cathy Pague, With you being out in all the health fairs and everything and expos in the community, do you find a lot of people are not aware about all the different services that you offer at Wuesthoff?
True. I do run into that quite frequently. A lot of people just think that we are just the hospital, and that's the only entity in Brevard County. But Wuesthoff Health Systems has many different entities, and one thing that's nice being affiliated with the hospital is not only do we service the patients out of our hospitals, but we can service the patients out of any hospital. And we provide the skilled care, nursing, physical therapy, occupational therapy, speech therapy, a home health aide. We provide those services right in the patient's home. Okay. And many Brevard County residents didn't know that Wuesthoff has that to offer.
Okay, well, I think that's important for them to know. And how does one pay for those services? Do you offer different levels, or is it Medicare and Medicaid, or is it private pay, etc.?
We, with Medicare, it's totally accepted, and all the insurances, you would just need to call our office because they would be the ones, our insurance specialist would be.
We accept so many different insurances that it's hard to have a list, but we do have a pretty large list that, yes, absolutely, if they called the office and they were in question whether we would accept them or not, we certainly could give them those details.
Okay, perfect. And is there a main number that they need to call for that?
Yes, it's 321-253-2200.
Okay.
And we also have a website, too. It's Wuesthoff Home Health FL. .com.
Excellent. Well, I have a term down here that I think a lot of our people might be interested in having one of you explain, and I'll leave it to either one of you. The term is telehealth. Who would like to elaborate on that?
I would be happy to. Cardiac is my favorite. I'm so excited about this. We did not have a telehealth system. Telehealth is for the cardiac patients. It can also be for high-risk patients, which we do service what's called an IPPR program, and that's identifying possible preventable readmissions to the hospital. So not only the cardiac patients, but we have pneumonia patients, we have fresh post-op, joint replacement. All of the high-risk patients would fall under the category of the IPPR, which means we would see them a little bit more frequently for the first couple of weeks with phone calls in between. We have daily contact with those patients, so that reduces the risk of readmission based on we can call them and talk to them and trigger some triaging things over the phone.
Excellent.
So that we can effectively take care of that before it gets too far. We can titrate medications with the physicians based on what symptoms they're feeling. The telehealth system allows us to do that in the home. It is a device that goes in the home, and we hook up to a pulse oximeter, which would take their O2 sats. Blood pressure we can do. We have a scale that for daily weight for the congestive heart failure patients, which is one of our biggest high-risk categories, patients who have open heart or they have previously had congestive heart failure. We're able to do daily weights, and if the patient goes a couple pounds over their base weight that we go in and weigh upon admission, then we are able to see that, wow, they're gaining fluid fairly quickly. We need to talk to the physician and get some of those medications implemented quick to alleviate that fluid. So we have them. The nurse goes in and sets up the equipment and trains them on how to do a dry weight, a daily dry weight. So we get the same time every day in the morning, and we know when something's changed immediately. That comes across my board, which I check routinely at least 4 times a day to see when someone is gone out of their normal parameters, and that way I'm able to call that patient and the case manager and the physician and coordinate a new plan of care based on their symptoms.
So in summary, this telehealth term is an extreme advantage to you then.
Absolutely. I would say that the physicians are just as excited about it as me, because it alleviates a lot of the problems, that sometimes they only see them once a month or even less frequently than that. And how are you to catch these problems in between, other than we're able to do that for them and keep them in close contact with the patients and how they're doing daily.
And you got to love technology, don't you?
Absolutely.
Well, if you just tuned in, you're listening to Helping Seniors show of Brevard, and my name is Kay Kaiser. I'm substituting for Joe Steckler today, and along in the panel here we have Kelley Way, who you just listened to. She's an RN, the clinical supervisor at Wuesthoff Home Health, and also in our studio, Cathy Pague, who's the home care coordinator. So if you have any questions you would like to field to either one of these gals today, by all means, call 631-1300, and I'm sure they'll be happy to answer any questions that you may have.
Absolutely.
All right. Well, I'll tell you what, it's amazing because I think what you said, Cathy, that being out in the marketplace, that many people just think about Wuesthoff as a hospital. And
right.
With all the different abbreviations of RN, PT, occupation, I mean, it just... Try to give that whole picture to our audience one more time, if you would, please, because I think it's important that they understand all the different services that you offer.
Well, just if I gave you a simple case, a person had a total hip or a total knee replacement, they would be discharged from the hospital. Our nurse would come out to see them within 24 hours of them coming home from the hospital.
Okay.
And also with that, they would get PT, which is our physical therapist, would come out and provide those services. Also, maybe they're having difficulty bathing, so they would be provided a home health aide that would come out with their daily, rituals, brushing their teeth and things like that if they were having difficulty.
Right.
Also, for our stroke patients, we have speech therapy and comes out to the home. That's the benefit of, Wuesthoff is because we have such a wide variety. And also a unique aspect is that we offer the medical social worker as well.
Okay.
So if you are in need of extra care resources, our medical social worker can come out as well and help you right there in your home. You don't have to leave your home to get those services.
Excellent. Well, that's one of the things Helping Seniors of Brevard does too. We try to help people understand. There are a lot of fantastic resources in Brevard County, but the bottom line is, it's a lot of people. They say, "Well, I'm not ready to go to an assisted living or a skilled nursing. I really want to stay in my home as long as I can." So with what you were saying, even if they wanted to have like a home health care come in to help them, whether it be hands-on, hands-off, you offer those services. Is that correct?
We offer the skilled services.
Okay.
In addition to a home health aide. So if they were receiving our nursing services or our physical therapy service, then they could get the option of having our home health aide come in and help them just with activities of daily living, brushing their hair, bathing.
Dressing.
Yeah.
Just maybe just getting hard to get up and down, too. So that's where that physical therapist comes in very importantly.
And I'd like to add on that. Our interdisciplinary team is just absolutely amazing. Again, I can't say enough about them, but there are a lot of times where the physicians will give specific orders for PT only or one of our services only. The nurse will come in and open that case, but one of the best valued assets we have, I think, is that our assessment skills are just amazing. When the nurse goes in for that PT only case, they're able to pick up on some things, and maybe what the physician didn't know is some underlying problems that when the physical therapist goes and the nurse goes together, the nurse might be able to say to the physician, they get them on the phone and say, I realize you only did PT only, you only gave us an order for that, but I'm seeing some other things, would you be interested? And so we're able to open up a full case because a lot of these post-op and other things are very difficult for these patients to deal with these life changes. So
Absolutely.
It was important, the addition of the social worker to be able to help while we're physically dealing with these things. They're also having mental changes.
Of course.
So we provide the whole package from head to toe, which I think is just really makes us stand out.
Well, that's excellent. You know, you've been listening to, we have Cathy, that's Cathy Way, a nurse, clinical supervisor with Wuesthoff Home Health, and Cathy Pague on Helping Seniors Radio Arm today. It's really important, I think, that people are getting a better picture of Wuesthoff now. You know, it's not just the hospital. And that's important for you in trying to go the full gamut, you know, from when somebody comes into an emergency situation and then carrying through when they've gone back home and so forth.
Right.
So that completes the circle, I think.
Absolutely.
Mm-hmm. And I think, too, you know, I hear so many stories about people thinking, well, they just got released from emergency room and they go home for a day and they're going back again. So,
Right.
you know, that comes off, you know, a little often. And I'm sure you try to prevent that by going that full circle so that they're taken
For sure.
well care
That's
of.
the ultimate goal, is to keep them happy and healthy.
Excellent, excellent. Well, listening to both of you, I'm sure you're very proud to be part of Wuesthoff and what you're doing. I can tell with your enthusiasm
No
here.
doubt about that.
And you've got to be doing a great job in helping the people in our community. So it's been a real pleasure learning more. And we're going to be coming back in about another few minutes with a second part of our program. And we're going to continue on in trying to help educate our listening audience more about what both of you do and what Wuesthoff Home Health is really all about in Brevard County. And maybe I think what might separate you from what else is out there.
All
So
right.
I'll give you a clue on that. Maybe we can kind of pre-plan that a little bit. So stay with us. We'll be back in a few minutes. We're going to take a quick break. And we'll continue talking to our guests, Kelley Way and Cathy Pague, with Wuesthoff Home Health from Helping Seniors of Brevard's Radio Arm.
AM 1300 WMEL.
Welcome back to the second half of the Helping Seniors show on WMEL 1300. My name is Kay Kaiser. I'm sitting in for Joe Steckler today. He had to take his grandchildren, I believe, to the airport. So hats off to Joe. I mean, I just can't say enough good things about Joe Steckler because we wouldn't be here if it weren't for him. But I'd also like to thank some more of our sponsors here that make this possible. Senior Scene Magazine, Hometown News, Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne, Beth Courtney with Braswell Team Financial Advisors, Kenneth Chiropractic, Canadian Meds of Melbourne, Wiedemann Malick, their attorneys, Vitas Hospice, and Peaceful Beach Mediation. This gal likes to keep people out of the courts if possible and solve things on a more peaceful basis. So if you're just tuning in, we're listening to the Helping Seniors show. My name is Kay Kaiser, sitting in for Joe Steckler. And I have in our studio today Kelley Way, who's an RN, the clinical supervisor with Wuesthoff Home Health, in addition to Cathy Pague, who is the home care coordinator. Welcome back to our second half, ladies.
Thank you,
Kay.
All right. Well, if you have a question you would like to pose to either one of our panelists today, by all means, all you need to do is call 631-1300, and I'm sure the ladies would be more than happy to respond to any of your queries here. And for those, again, who are just tuning in, if you'd like to call Helping Seniors of Brevard, you have a need to find a particular resource, or maybe you have a few issues that you need and you're looking for help on, by all means, call our office, 473-7770. I always return the phone call, so I'm not physically there right now. We're on the air, but please call 473-7770, and we'll be happy to help. So I kind of gave you a hint of what I would like to have both of you maybe respond to in your own words. What makes Wuesthoff different in our community?
So many things. But I think the biggest thing is, again, I keep bragging about our team. We just have the most awesome team. Everyone works together. When one's out sick, the other one fills in. There's no complaints. We just get it done. But I also want to say we have 24-hour on-call service 7 days a week. We have a weekend nurse that's there to intake and triage. We have an answering service after our normal 8 to 5 business hours. So we offer nonstop service, and I think it's kind of hard to beat that. I think that's what separates us.
Well, you made a comment, too, to me during our break here, Kelley, that you have been in the nursing business, per se, for 23 years.
Yes.
Share that comment again. I think I find that rather fascinating.
The truth of the matter is, for the 23 years, when you're a new beginning nurse, you have all this nervousness. Oh my gosh, I really have to take care of real people and not dolls anymore. But I think the more mature after 23 years of nursing is, I love it more today than I did when I started. I have a greater appreciation for people and how we can make an impact individually and then together as a team.
Oh, that makes perfect sense. And you've seen all the technology changes throughout the years, too, haven't you?
Makes me sound old.
And you look so young.
Thank you. As a matter of fact, everything that we do is on a droid, a smartphone now. And it's just crazy how we can talk to these physicians and make faxes and do things directly. And just a huge time saver. It's just incredible.
Much more efficient today, isn't it?
Absolutely. Which, in turn, ultimately, it helps the patient.
Absolutely. I concur. That has to be much more advantageous to you than it has been when you first started.
Yeah, lots of paper and pens.
Well, I think that's another thing that sets us apart from some of the other home health agencies is we are electronic like that. So when our nurses are going out into the patient's home, they have the whole entire chart electronically at their fingertips. So they can bring up...
It is a huge difference.
Yes. The patient's, most relative medications or their history or whatever right there. And while they're assessing the patient, they enter it all into the droid. Sometimes our patients want to know what game they're playing or who they're texting, but we're not. We're taking care of you.
Sure.
And so that's a really unique feature that I think our service offers is the electronic communication that we provide the physicians regarding the care of the patient.
Well, you mentioned that they're thinking that you might be playing a game.
Right.
Because so many seniors think, oh, my goodness, my grandchild has that, and they're playing a game on it. So I can visualize how that comment could come up.
Exactly. We're not playing games out there. We're providing the best care possible.
Excellent. Well, if somebody was interested in learning more, excuse me, I'm losing my voice here a little bit today. Let's go and review a little bit once again, if I may. Kelley, when I'm going to address this question to you, explain how different levels of care may require different types of assistance.
That's a good question. Again, we evaluate the patient, we do the assessment, we see what their direct needs are, we follow the physician's orders specifically. However, in doing that, when you do a head-to-toe assessment, the nurses almost always indefinitely pick up on something other than what they were there for. And so that may push them into a different category of maybe a more detailed plan of care. Maybe we need more types of therapies than just what the physician has ordered. And it's up to us when we're there and we can physically see the patient and the physician can't, to speak with the physician and coordinate make recommendations. The physicians absolutely love for us to be able to see something that they don't see because they can't possibly be with the patient 24 hours a day.
Nobody
Some
can.
of those things, when they're more relaxed in their own home,
Right.
may become apparent that isn't in the office when they're nervous, or questions that didn't get answered while they're in the office that they can't think of.
Well, I can relate to that, too, because just speaking with the callers that call me at the office, and again, that number is 473-7770, oftentimes, they'll get the comment, well, you mean you're going to take time to talk to me? I said, of course. I'm not just going to give you a number. I want to make sure that, because I find that often, more than not often, when a caller calls in, they have more than one issue.
Sure.
But in just taking the time and speaking with them, not rushing them, they'll open up. And I swear, I think some of these people keep our number on the refrigerator.
Well, actually, in our case, they do. That's education that we provide in the home, and every nurse makes sure that our phone number, how to get in touch with us, the case manager, our office, anything that they might need, and we review that on every visit to make sure that they can. And if we do discover that there's some reason why they would not be able to see that, there's not large enough print, or whatever they may need to be able to facilitate our number, we make sure that we do that in the home while we're there, so that they know how. That's what we pride ourselves on, calling us first. That's one of our logos in education. You know, we want to avoid that hospital visit. We know you want to stay in your own home. How can we effectively take care of you so that you don't have to? And a lot of those problems are fixed by calling us first and getting a nurse on the line and being able to have a nurse 24 hours to ask those questions and which way do I really need to go? Because some of these people, this is something new happening to them. They've never experienced, and they just need to know I'm okay right now.
Right, and be reassured.
Sure, absolutely.
And I wanted to add to that the caregivers in the home are there for the patient. They might not be able to go to all of the appointments, but our nurses can come out when the caregivers are going to be there. So it's always better to have that caregiver that's available, and we can train that caregiver on the proper lifting technique and things like that when our services do end. Medication management. We also provide a lot of education and support to the caregivers as well.
Well, and that's kind of our philosophy, too, because helping seniors, when Joe had the vision, was to educate, inform, and connect seniors to resources. So we like to consider ourselves full circle here, too. If you're just tuning in, you're listening to, my name is Kay Kaiser, along with our panelist, Kelley Way, who's an RN, clinical supervisor, and Cathy Pague, the home care coordinator for Wuesthoff Home Health. Again, in looking at down the road, if you had to get a percentage of seniors that call on your nurses, what would you say? Would that be considered a pretty big majority?
At least 80%.
Oh, okay. All right.
And I find a lot of times it's just inevitable. We're all going to age. There's nothing that we can do to stop that. Some of us a little bit more gracefully than others. But, things are starting to fail as we get older naturally. Right. There's nothing that we can do about that. And I'm finding with the elderly that sometimes, like you said, someone who's hard of hearing, maybe just taking that extra 5 or 10 minutes to write something in large print for them. Absolutely. To reiterate and actually look at them when you're speaking to them, because a lot of them read lips. They don't want to burden you.
They're afraid in many cases of just asking those questions. And, to have somebody take the time to listen to them, that makes all the difference in the world.
It really does. It really does.
So I think, looking at it's kind of addressing the importance of good case management, looking at that aspect. You have a comment on that one?
On our case management?
Yes.
Each patient has their own case manager that coordinates all of their care through all of the different disciplines. Maybe a patient could have a home health aide come out, a physical therapist come out, a speech therapist come out. You could have 5 different types of disciplines seeing you, yet we provide a nurse case manager who oversees all of that and makes sure everyone is on the same page, correlating everything together. Very specialized care.
Yeah, so you're all communicating together during this entire process.
Yes.
We just left case conference this morning. We have case conference every 2 weeks on a Thursday at 8:30 in the morning, and we get the whole team together. That's all of our nurses, all of the therapists. Cathy's there. We pretty much just involve everyone, all aspects of the team. Good. And it allows for a great opportunity for the therapist to be able to speak with the nurses and find out, just kind of where they're standing at their level of care, their plan of care, and do we need to readjust at this point in time. Certainly they communicate every time they have a visit. The therapists are required to report to the case manager, and there is another clinical supervisor along with myself, and so whoever's team that's on, they also get CC'd on that so that we all kind of know what's going on and we're all involved in that care, which, again, that's extremely important to... Maybe the therapist that was there didn't see something, then the nurse comes in and she sees something related to therapy or, anything new. So they all coordinate with each other. They make a phone call. They send an email. But I think the case conference, really is able to keep us all on the same page with the patient.
I think from your aspect, too, in marketing, that'd be a great marketing aspect to go after because everybody's in the loop. And making those patients feel like they're really special, that there's not just one person that's looking at this person. There's many involved behind the scenes here that person may not even see. But the communication and going that full circle, to let the patient know that you're really behind them in all aspects.
And that's a good point because one of the things that we've really tried hard to, for the patient, from the patient's point of view, is that they don't want to see a different nurse every time someone comes to their house. If they've got a couple therapies in the home, you want to see and build a bond with the same person. So
that's very important,
Extremely.
Many times if I get a call from somebody looking for somebody to, I just need a companion. Right. Or I need somebody to drive me. I need somebody to help clean. But then it could be the daughter or son that's actually calling for mom and dad, or that senior citizen. And then when it comes down to, well, I really don't want to have anybody come in my home, mom and dad says, because it's my domain, it's my palace, and to have a stranger, it has to be comfortable, so I can definitely relate to that.
Well, it's sense of security again. The security is heightened as we get older. We can have alarm systems, we can have all those things in place. Right. But really, when you're bringing someone into your personal space, you have to be able to trust them. And I think that if they can trust us, and build a bond with that same therapist, that same nurse, that they're going to open up more and give us more details that's going to help to take care of them a little bit better.
You know what, and I'll tell you what, you mentioned the word trust, Kelley, because it really is important. We've got wonderful partners, our sponsors behind helping Seniors of Brevard. And I know that when I refer one, I feel confident. Then I tell that caller that they're not going to take advantage of you. They're trustworthy. And so, to set the stage to say, it's okay. We know these people. We work with them. They help support us in order to help you.
Right.
So it all works together, I think. How better use of the various types of care, let me put it this way. How can better use of various types of care tend to drive down the overall cost of care?
Well, everything is costly at this point, and especially for the elderly who have a limited budget to begin with. Some of them are just strictly living off of disability, which makes the price of medications is just a little bit outrageous. So anytime that we can, provide, we have the materials and we find a way to financially help these patients. That's part of what the social worker does as well for them. But if we can get things done, get them done in a timely fashion, we can get them done adequately and appropriately and have the patient in the best possible health. That certainly drives the cost down because we're in there. We're a total package. We've gotten everything done for the patient. We're able to save, physician visits and still give the care and the coordination and the communication. Right. So we're able to drive the cost down for the patient by doing everything in the home with all of these therapies and
instead of going to a facility after a surgery, they can come home and get that care in the home. We can provide all of that. And also, there's a benefit to that, too, because when you come home from a surgery or some type of event, your house might need to be adjusted a little bit. Sure. A rug might need to be moved so you're not at a fall risk, things like that. So those are all benefits right in the home that we can provide. That is very cost effective.
That makes sense.
For our patients.
Absolutely.
Yeah, one-stop shopping is always good.
That way you don't have to think too much about it.
Right.
Well, that's kind of what we think helping Seniors of Brevard, too, is. Let us be the source to help our callers out there and put you in touch with the right resources to help you along.
We do also, we have some other DME companies and things that we do provide. They're able to provide resources to us. And I think those things are important too, because we have a place that we can sub out, that we call when we have a patient that needs grab rails, safety equipment, things like that.
Right.
And most of them qualify with Medicare and other insurances for someone to come in and install those things free of charge or for a very small cost. So
there you go. That's
important. I do want to give a little shout out to our director, our administrator, because without her, a lot of the things that we're implementing for these patients wouldn't be possible. Christy Sanford is one of the most amazing, giving people I've ever met, and she, I think, has implemented with us that there isn't anything we can't do for these people attitude. So
great. Definitely a bend over backwards type of administrator that goes out of her way to not only help the employees but each patient, and whatever we can do to help them recover faster.
Well, you said both of you ladies have indicated what a great team you've got over there.
I can't say that enough. I think you've heard it at least 6 times. But it's true. It really is. It's really easy to come to work when you have a supportive system.
Yeah, it makes all the difference in the world. And like I was telling you, too, on the break, I go to work every day and I don't think of it as a job.
Right.
You know, because if I can help one person, then I'm doing some good in the world here.
Absolutely.
So,
that's a rewarding feeling.
It really is. And we want seniors to age with dignity and to look at the different options of what they've got available in our community, such as the Wuesthoff Home Health. You know, they didn't know that you did all of these different services. So I'm glad we've had the opportunity to explain Wuesthoff is not just a hospital.
That's right.
Right.
We're all
so
going to
much
be there
more.
someday.
Yeah.
And Kay, you can meet our great team at our open house in October.
Yes.
If you would like to come out, and welcome all of the listeners as well to come out to our open house to meet our great teammates and nurses and therapists. And for more information on that, you can call me at the office at 321-253-2200. We'd love to see you there.
Oh, great. That's exciting.
We're very
That's
excited.
really exciting. Well, like I said, too, we're coming up to our year anniversary,
Yeah.
actually opening up the office next month. So it just flew by. It just seemed like yesterday we opened the doors here. And again, I wanted to let anybody know that if you're looking for resources, certainly call our office at 473-7770. I'll be happy to put you in touch with the right resource. And many of our partners, such as Wuesthoff Home Health, is one of them. And we've had a great opportunity to explain to our audience what more you are doing in our community. So that's very important. With that, I want to really thank Kelley Way.
Thanks for having us.
Yes, and Cathy Pague here.
Thank you, Kay.
It's been a real pleasure speaking to both of you and learning so much more. I'm sure I've learned more. So if I know more, I can help more people too. So it did,
That's
just
great.
One good thing goes to another good thing here. So I really enjoy speaking to any of our sponsors here and anybody that would like to learn more information. We have a website too that we archive everything on in print. The TV programs, this radio show will be up there, and that is simply helpingseniorsofbrevard.org. We also have some more sponsorships available, too. So, now, it's just amazing. We're going to continue to grow. We're going to continue to help people. And, again, I want to thank everyone for tuning in today and listening. And, again, another special thanks to Kelley Way and Cathy Pague. It's been a great pleasure meeting and speaking with you today. So with that, I'll say adieu, and I'll sign off and replace Joe Steckler will be back on next week. And again, it's been a real pleasure speaking to you.
Thank you, Kay, and thank you, Joe.
You bet. Have a great day, everyone, and tune in next week, same time. Thank you.